The primary learning objective of this article is to demonstrate the value and potential clinical applicability of a systematic, objective method for examining linguistic style in Clinicians' Treatment Notes 1. Specifically, the article aims to teach clinicians and supervisors how computerized linguistic analysis can provide clinical insights. It proposes the use of computerized text analysis procedures, focusing on measures like mean high referential activity, MHW, and reflection, REF, to study Treatment Notes 1. The article aims to show how these linguistic measures can be used to track the overall trajectory of a treatment and identify nodal points or potentially critical areas that might be overlooked in a purely clinical reading one. To recognize critical periods in treatment, the authors illustrate how variations in linguistic measures, particularly the MHW/REF difference, can serve as guides for assessing ongoing clinical notes and recognizing when a treatment might be becoming ineffective or having a negative effect. 48. For instance, a high positive MHW/REF difference suggests intense emotional engagement by the speaker/writer, indicating they are living in the experience immediately, whereas lower MHW and higher REF indicate less emotional intensity and more emotional distance. 9. To refine interventions, the method has the potential for use in ongoing treatments to help clinicians refine their interventions. 110. By identifying problems in treatment at an early stage, it allows for rectification or appropriate referral. 8. To understand the analyst's own experience, the treatment notes, written by the analyst, permit examination of the analyst's own experience in a way that session tapes and transcripts alone may not. 11-12. This can provide insights into unconscious aspects of the analyst's experience, defensive behavior, thinking, emotion, values, and attitudes, offering perspective on countertransference and the analyst's role in the therapeutic process. 11. To bridge the science-practice gap, ultimately, the article seeks to demonstrate to psychoanalytic and psychodynamic clinicians the value of systematic empirical studies for their work with patients and in teaching their students, thereby narrowing the gap between science and practice in the mental health field. 2. The comparison of two contrasting cases, one successful, one unsuccessful, serves to illustrate how the language measures pointed to critical periods and how the analyst's activity, or lack thereof, regarding emotional engagement correlated with the treatment's course, thereby providing concrete examples for learning. 1. The long-term goal is to equip analysts with an understanding of where an analysis is going or has gone right, and where it is going or has gone wrong, enabling them to modify their analytic technique in an ongoing way to fit a particular patient's needs at a particular time. And now, here's a summary about the objective measures of language style in psychoanalytic treatment notes. Executive summary. This study proposes and demonstrates the utility of computerized text analysis, specifically focusing on linguistic style in psychoanalytic and psychodynamic clinical practice. By systematically examining clinicians' ongoing process and case notes, the authors aim to bridge the gap between science and practice in the mental health field. The research introduces two key linguistic variables: mean high referential activity, MHW, which measures language's connection to emotional processing, and reflection, REF, which indicates the use of words referring to logical functions. By tracking changes in the relative positions of these measures, the authors suggest that nodal points in the treatment that might be analytically or therapeutically problematic and that might be overlooked in a solely clinical reading can be identified. The study illustrates this method by comparing two contrasting cases from historical archives, one successful and one unsuccessful, demonstrating how linguistic analysis of notes can provide objective insights into treatment trajectory and therapist interventions. 2. Main themes and key ideas. Bridging the science-practice gap in psychoanalysis. The authors highlight a significant historical gap between science and practice in psychoanalysis and psychodynamic psychotherapy, arguing for the necessity of systematic empirical studies to demonstrate their value to clinicians. Computerized text analysis of treatment notes is presented as a novel method to address this gap, offering an objective approach to studying the clinical process. The value of treatment notes as a data source. Ongoing treatment notes, process notes, or periodic summaries are recognized as a traditional database for psychoanalysis and psychodynamic psychotherapy, used for training, supervision, case reports, and theoretical validation. The authors assert that no other method of studying psychoanalysis can give us this same information, fragmented and distorted as it inevitably is, about the psychoanalytic process, Colombo and Michaels 2007, page 640. Writing notes can also offer access to unconscious aspects of the analyst's experience, defensive behavior, thinking, emotion, values, and attitudes. It makes available for reflection many of the dimensions of lived countertransference and provides some perspective on the analyst's role in therapeutic process and change, as both a transference object and a new object. Glick 2008, page 1228. The study emphasizes that notes allow examination of the analyst's own experience, which is not possible with session tapes or transcript alone. Key linguistic measures: referential activity, RA, and reflection, REF. The study focuses on two empirically derived linguistic measures. Referential activity, RA, assesses the degree to which language is connected to the nonverbal elements of emotional processing and indicate the degree of effective connection of a language. High RA language is described as vivid, imagistic, and detailed, and contains sensory information, evincing an active and direct connection between imagery and words. Low RA language is abstract and general. The Weighted Referential Activity Dictionary, WRAD, is a computerized tool used to identify lexical items associated with RA. Common function words, articles, conjunctions, pronouns, such as and on, that are indicative of high RA language. Mean height WRAD, MHW, is the specific measure used, representing the average degree of intensity of emotional engagement. Reflection, REF, measures the use of words that people use to describe how they think and communicate thought, including words of basic logic, such as if and but, words referring to cognitive or logical functions, such as think and believe, or referring to logical entities, such as reason and cause. REF serves as an indicator of regulating or distancing emotional experience. Interpreting MHW/REF differences and nodal points. The relationship between MHW and REF is crucial for identifying critical treatment periods. High positive MHW/REF difference, relatively higher MHW and lower REF indicates intense emotional engagement by the speaker or writer as the experience is described. The speaker or writer is living in the experience immediately in the moment and not standing back to reflect on it. This is associated with uncovering phases of treatment. Relatively lower MHW and higher REF. Low or negative MHW/REF difference indicates less emotional intensity and more emotional distance from the contents by the speaker or writer. This is associated with containing and also in avoidant or distancing phases. Variations in these measures provide a diagram of the clinical course and can help clinicians recognize potentially critical areas in the treatment, e.g., turning points that we call nodal periods, that may be missed when the material is viewed only from the clinical perspective. Case studies: successful versus unsuccessful treatment. The study compares two cases from historical archives, 50T1, unsuccessful, 70T3, successful, to illustrate the application of these measures. Case 50T1, unsuccessful. Initial prognosis was excellent and worthwhile candidate for psychoanalysis. However, the patient deteriorated so severely during the subsequent years, ending with GAF and PFS scores below clinical criteria, CCE score 0. Linguistic analysis showed REF initially slightly above MHW. Then MHW declined and REF increased, indicating increasing distancing and decreasing emotional engagement by the analyst. Clinical analysis of 50T1. Early in treatment, the analyst seemed not to respond to the patient's communication and instead seemed to have his own agenda. A temporary increase in MHW/REF difference in spring 1952, analyst writing in a more emotionally engaged manner, coincided with the analyst communicating understanding of the patient's affective state and conflicts, particularly regarding reliance on other men. This gain was lost in summer 1952, prior to a summer break. The analyst did not continue to communicate to the patient that he understood how upset the patient was about the summer break and that the patient had to deny his closeness and dependence on the analyst. Instead, the analyst focused on the patient's aggression without communicating to him that it would be valuable to understand the meaning of the aggression. The analyst 50T1 did not like, or was afraid of, the patient's connection to him, perhaps particularly the homosexual transference. This analyst focused on content interpretations, whereas analyst 70T3 focused on the process, particularly the transference relationship. The analysis was terminated by the analyst after approximately 1.5 years, shortly after the analyst began to actively address homosexual thoughts and decided, with supervision, to terminate. The authors conjecture this termination decision may have been influenced by the tenor of the times regarding homosexuality in supervision. Case 70T3, successful. Initial prognosis was less positive than 50T1, with mixed feelings about her capacity to undertake psychoanalysis. However, the treatment was successful, CCE score of 8. Linguistic analysis showed high MHW and a positive difference score initially, which declined to a low point, negative difference score, from October 1972 to March 1973. Clinical analysis of 70T3. During the initial decline in MHW, the patient discussed traumatic events and felt a need for protection from the analyst, while also feeling that interpretations were attempts to prove she couldn't handle herself. The notes indicated many unexamined negative feeling states toward the analyst. Crucially, the analysis repaired in the subsequent phase, April-September 1973, with MHW returning to a higher level than REF and remaining elevated for 3 years. The analyst in 70T3 directly addresses the defensive nature of the patient's anger. If you are so angry, you must be upset about something. This let the patient understand that one can have mixed feelings. In contrast to 50T1, who avoided patients' feelings of missing, analyst 70T3 was able to communicate an understanding of the patient's need for closeness. The analyst in 70T3 consistently interpreted the patient's mixed emotions, understanding that the patient wants to be asked to stay but protects herself from hurt by threatening to leave. Implications for clinical practice and supervision. The study strongly suggests the need for monitoring of treatment effects beyond the usual supervisory practices. Had linguistic scans been available for case 50T1, the analyst and supervisor could have seen that something was going wrong in the sessions before the first summer break, something not clinically discerned. This awareness might have allowed recovery and progression of the analysis. The method has the potential to provide analysts and therapists and their supervisors opportunities to refine interventions with patients in ongoing treatments. Real-time digital processing of notes could allow language style analysis to guide the practitioner's recognition of a difficulty in the treatment as the situation is evolving rather than long after the fact. Limitations and future directions. The study is exploratory, using only 2 contrasting cases, which may confound the conclusion that the language measures can reliably differentiate success from failure. Future research needs to replicate findings with other cases and other gender configurations, and on a large sample of different types of treatment. A more fine-grained analysis of the linguistic measures, e.g., a time series analysis, would be required to determine whether the clinical effectiveness followed was concurrent with or preceded those shifts. The current study used archival notes, not real-time process notes, he said. I said, examining linguistic analysis of detailed process material yields results similar to or different from those drawn from more general case descriptions is a future direction. The method could be used to study analyzability and patient dropouts. 3. Key facts and figures. Study design. Application of computerized text analysis to ongoing process and case notes of psychoanalytic and psychodynamic clinicians. Linguistic variables. Mean high referential activity. MHW degree to which language is connected to emotional processing. High MHW equals emotional engagement. Reflection. REF use of words referring to logical functions. High REF equals emotional distance/regulation. Software used. Discourse Attributes Analysis Program, DAP, constructed by Maskit. Previous research context. Built upon Wilma Bucci and Bernard Maskit's long-term project integrating linguistic analysis of sessions with clinical evaluation and Bucci's multiple code theory. Sample size. Overall project 14 analyses from the New York Psychoanalytic Society and Institute Treatment Center archives, latter half of 20th century. Selected for contrasting outcomes, successful/unsuccessful, based on contemporaneous evaluations and current GAF, Global Assessment of Functioning, and PFS, Psychodynamic Functioning Scales, ratings. Clinical effectiveness measures from initial study GAF, DSM-4 score of 61 or better at termination indicated positive outcome. PFS Psychodynamic Functioning Scales, 6 scales, quality of family relations, quality of friendships *, romantic/sexual relationships, tolerance for affects, insight, problem solving, and adaptive capacity. Quality of friendships excluded due to low reliability, ICC less than 0.6. Composite clinical evaluation, CCE a composite score, 0 to 8, based on GAF and PFS N-scores and change scores. Correlation of 0.733, P equals 0.003, found between MHW of candidates' notes and CCE. Outcome distribution, 14 cases 3 showed considerable improvement, CCE 7 or 8. 4 showed moderate improvement, CCE 2 or 3. 7 showed essentially no improvement, CCE 0 or 1. 4 cases showed a decline in both GAF and overall PFS ratings. Average decline, 6.25 GAF points, 5.6 PFS points. 2 illustrative cases for detailed study. Case 50T1, unsuccessful CCE, 0, minimum score. Beginning GAF, 53. Ending GAF, 45 decline. Beginning PFS, 52.6. Ending PFS, 48.8 decline. Duration, 22 months. Initial prognosis, excellent and worthwhile candidate, excellent prognosis. Linguistic trajectory. REF initially slightly above MHW, then MHW declines and REF increases. See Figure 1, indicating distancing. Case 70T3, successful CCE, 8, maximum score. Beginning GAF, 65. Ending GAF, 80, improvement. Beginning PFS, 56.4. Ending PFS, 78, improvement. Duration, 5 years, 9 months. Initial prognosis, good, though there were questions, less positive prognosis than patient 50T1. Linguistic trajectory, high MHW initially, decline, MHW below REF, then recovery, MHW returns above REF for long period, and a second decline towards termination, see Figure 2, followed by recovery. 4. Conclusion. This study effectively demonstrates the potential of computerized linguistic analysis of psychoanalytic treatment notes to provide objective, real-time insights into the therapeutic process. By quantifying linguistic styles related to emotional engagement, MHW, and reflection, REF, the method can identify nodal points in treatment where dynamics shift, potentially indicating areas of difficulty or breakthrough. The detailed comparison of a successful and an unsuccessful case highlights how the analyst's linguistic style, reflecting their engagement and approach to difficult material, e.g., transference, patient's anger, dependency, correlated with treatment outcome. The authors advocate for integrating this method into supervision and clinical practice to enhance understanding, refine interventions, and potentially improve treatment effectiveness, especially in cases that might otherwise veer towards negative outcomes despite promising initial prognosis.